COVID-19 vaccines in children are generally safe, but may have potential side effects. It is always prudent to inform patients and guardians about these to help them make the best decisions for their children. Hey, welcome back. Last time, we discussed the patterns of new cases and deaths related to COVID, particularly during the Omicron surges in several countries. Now, recently, a lot of countries have implemented pediatric COVID-19 vaccination, with some countries allowing vaccination of as young as 5-year-old children. Of course, when talking about the health of kids, there will always be more heated discussions on safety, risks, and benefits. COVID-19 vaccines, as with any medication, have potential side effects or adverse reactions associated with them, but these do not normally come up in news stories. So, to help inform those who are still wondering what to expect, or rather what to watch out for during pediatric vaccination against COVID, let's discuss an article by Hause et al., published on December 31st, 2021, by the Morbidity and Mortality Weekly Report of the U.S. Centers for Disease Control. In this study, the authors enumerated the most common serious and non serious adverse events associated with COVID 19 vaccination in children 5 to 11 years old. The study defined these serious adverse events as those associated with hospitalization, prolongation of hospitalization, life threatening illness, permanent disability, birth defect, or even death. The data they used mainly came from VAERS, or the Vaccine Adverse Event Reporting System, which is, quote, a passive vaccine safety surveillance system co-managed by CDC and FDA, unquote, as well as from VSafe, a voluntary smartphone-based safety surveillance system for adverse events after COVID-19 vaccination. Please note that their report covered only data from November 3rd to December 19th, 2021, and that only the Pfizer vaccine was included in the analysis. Approximately 8.7 million doses of the vaccine were given during this period. Overall, there were 4,249 adverse events reported in VAERS during the study period. Table 1 of the study shows us that non-serious adverse events are basically similar across males and females, but most serious adverse events were seen among males. This is actually consistent with data among older COVID patients. Males tend to have a higher risk for more serious infections. Looking at Table 2, most reports in VAERS were actually preparation or administration errors, but we are not really interested about those. In terms of adverse events, vomiting and fever were the most common, whether non-serious or serious in nature. Other common non-serious symptoms include headache, syncope or fainting, dizziness, and general fatigue. Other serious adverse events include heart-related symptoms, headaches, and seizures. I'll probably do a video looking deeper into the controversial issue of myocarditis in pediatric mRNA vaccines when I have the time. Like and subscribe so that I can quit my job and do research full time. The report from VSafe actually paints a slightly different story. There were a significantly higher number of reports in VSafe compared to VAERS, with more than 72,000 reports. Most reports in VSafe were about injection site reactions, such as pain at the injection site, swelling, redness, or itching. This is actually more consistent with any injection-based medication, and I'm really wondering why injection site reactions were not mentioned in the VAERS table. There were also systemic reactions reported in VSafe, with the most common systemic symptoms being fatigue, headaches, and fever. Other systemic adverse events, according to the number of cases, include general body pain, abdominal pain, nausea, and even chills. After vaccination, some children were also unable to attend school or perform normal daily activities, while a few actually needed medical attention or even hospital visits. Now, while the report showed some numerical values and percentages, we have to be cautious in creating conclusions about it. For one, the results came from passive surveillance reports and self reported data, and often these types of data underrepresents non-serious adverse events. To put it another way, while we mentioned that over 8.7 million vaccine doses were given during the study period, the low number of adverse events discussed in this video cannot be assumed to relate to those 8.7 million doses. Realistically, we should be expecting a larger number of adverse events, but how much larger, we can't be certain from the study results. At most, their conclusions are only relevant to those who actually reported into the systems. The authors even included this limitation in their paper. In any case, the study also concluded that while the pre-authorization trials by Pfizer did not report any serious adverse events, both the VAERS and VSafe systems reported both non-serious and serious adverse events during the period of monitoring childhood COVID vaccinations. In summary, the patients and guardians of children aged 5 to 11 years old should be aware that the Pfizer COVID vaccine brings to the table both benefits and risks. Adverse events are present, although occurring relatively rarely, and with those adverse events being non-serious and not needing hospitalization, at least for the most part. The most common non-serious ones include pain at the injection site, fever, headaches, and fatigue. The most common serious reported events include more serious fever and vomiting, and reports of chest pain and seizures. But in any case, as a medical doctor and a public health practitioner, the point is that it should always be up to the parent or guardian of the children to look at the risks and benefits of any pharmaceutical intervention. The role of doctors and researchers is to just guide them by giving them all the information that they need in order to make the best decision for their ward. If you are a parent or guardian, at least by viewing this video, hopefully you are more informed about what to expect. And if you are still unsure, and if you haven't done so already, consult your child's doctor.
I've been dreaming on in my head like I've seen it. A life worth living is a life with meaning. I'll do what I love till my heart stops beating. I'm feeding